We'll try to go to those areas. We will also look at, where have we not visited as of yet, so making sure that we're being very broad with our reach.
Do you think Bonnie's Bus is the most effective way to detect breast cancer?
I think it's definitely a key that is missing. It's a link. In West Virginia, we have a lot of disparity here related to cancer. And for women who live in rural areas, as I mentioned, there's a good number of counties in the state that do not have radiology services or an existing mammography facility. So anything that we can do to help to ensure access, either by bringing Bonnie's Bus in so that women don't have to travel as far to get to those services, or being able to offer mammograms to women who may not have insurance. We've been very fortunate to have received some grants to be able to provide some financial assistance to cover the service for women who cannot afford it.
Do you think it's better for them to do something like that, like go and get in touch with Bonnie's Bus, or try to take preventative measures as in better dieting or eating healthier, or is it all kind of mixed together?
It really is all interrelated. Looking at comprehensive overall health is the key with breast health. So definitely screening is part of that.
Do you think this could be a model for other states or maybe even other countries?
Most definitely. A lot of states do have mobile mammography services. One thing that is very unique about Bonnie's Bus is that ours is a statewide service. Some of the other states that I have been able to learn about their programs, they may only be offering their service in certain geographical areas, or they might be located in a larger metropolitan city, so they may only be covering a smaller geographical area. So that is the one thing that is different about Bonnie's Bus, in that we are offering the service statewide.
What was I going to ask? If someone was trying to help or get involved with Bonnie's Bus, they felt compelled to help, how would they go about that?
I would suggest that they get in contact with the Bonnie's Bus administrator. There are a lot of different ways in which someone might be able to help work with Bonnie's Bus. Some of the organizations that we work with, I'll give an example, the Breast and Cervical Cancer Screening Program. In one of the counties, the regional staff person for the Breast and Cervical Cancer Program enlisted the help of some of her community volunteers, and they were able to go out in the county and post flyers about the upcoming Bonnie's Bus visit, and they were doing their best to help us promote the visit.
Nice.
Is Bonnie's Bus active through social networking?
We are in the process of moving in that area, and so there are plans to try to become more active and have a presence on Facebook and other social media.
What have you had any ideas what you're going to even put on there, how you're going to attract to get more people to look at those social networks?
That I'm not involved with that project.
No, not involved with that?
So I would say scratch that
Right,
question.
Right. No worries. All right, so what about the feedback that you give back to the patients? How important is that, and what type of things are you giving back to them?
Okay. Well, as with any mammography service, whether someone goes to a fixed mammography facility or getting service on Bonnie's Bus, the woman and her healthcare provider do receive notification of the results of her screening mammogram and a recommendation as to if she needs any further evaluation and follow-up, or if everything was okay and if it's recommended that she come back the following year to have her screening. One of the other things that I've been involved with Bonnie's Bus is that for women who do need to have some further evaluation, we are working on doing some follow-up and tracking of those patients, just to make sure that they are being able to get those services, and that's one of the unique things with this service.
What's your favorite whole part about all this? Your favorite aspect that you have, or anything like that?
I think for me, it's being the times that we've actually been able to interface with women who have been screened on the bus. I've had a couple of calls from women that they were screened on Bonnie's Bus last year. They were wanting to know, when is it coming back to their community, and they just talk about the wonderful experience that they had and that they've told all their friends about it. And so that personal level is what keeps me very interested in working with this project.
All right, cool.
Do you have anything else to add?
No, I don't believe so.
All right, I think that went well.
Okay.
All right, cool, thanks. Hit the end of record.